Association, a board director, and person for the communications. Today it's my pleasure to be here, and this is excellent initiative where I see a lot of potential and hope in the future that we will change something. Why I'm speaking? We attack all the challenges from different kind of aspects, but what we forget to mention is that in the moment about health, when we speak in the European Union, we have a lot of bubbles, which are fortunately not under the one committee. I'm speaking committee. Maybe one of the challenges in the future is that we to provide a committee which gonna collect all these bubbles, agencies which are existing somehow in the area in the moment, especially after the COVID-19. We know that in the new structures coming a lot of other agencies and a lot of other committees, subcommittees, which are trying to be part of this health issue. And after that, because we are speaking about the health, and was mentioned that the health is a little bit not like more or less the other DJs. How the parliament can help in this position? I see a lot of things the parliament, how can help us in the future, especially if we discuss now, if we open the subject, because if we see the well-being for the patient in the next period, I see a lot of hope that this EU Health Union question, which we are trying to raise, especially the past 2 years, really to make something, let's say, mission possible in the future. I'm coming from the liver field. Also, it's very tricky because I see a lot of, let's say, somehow, some people say to me, a lot of big organization. What's mean big organization? Also, it's a question. For example, in this moment, in the liver field, we have huge problem and burden because we have more than 200 million people in Europe who have a problem with the liver, with NAFLD, not alcoholic fatty liver disease, alcoholic, and hepatitis, 30 million people. And what is the response here? Do we have response, equal response from the member states, from the Commission? We have, for the first time in the history, a chance to eliminate such a dangerous disease for hepatitis. We have action plans, we have strategies from WHO, from everybody. But through the EU Cancer Beating Plan, we see a good opportunity now through different kind of fundings, organizationals, NGOs, also member states are very important. I will open the discussion. It's not just how to fundraise ourselves if we like to achieve some kind of input, because we really would like to see the input even to the member states. From here, from our discussion, really, I'm using every time when I have a meeting on the national level that I'm here with each one, with all of these people, how we're raising these questions here. And I must be honest, they like to listen when it's coming something from here. Really, they like, especially if you address also with us on the national level, with some recommendation in some kind of position, it's coming, let's say, some beneficiaries for us. It's very important, the work on European level, but put boots on the ground. And the fundraising to this, let's say, operational grants, for us, I think it's somehow, let's tricky in the moment, how they are given, let's say, how they give them, who is available or accessible to reach this. The input, which was mentioned previously, how is the measurement for the Commission, not just how we spend on the end of the day, really. We need to have some inputs, what is going on behind of this initiative, which is done. Yes, we have a lot of organizational, let's say, challenges, but between them, we are working on the ground and we are delivering some kind of, let's say, services already established. This is very important to be somehow synchronized in the future. I'm seeing this, the Parliament, that can help a lot.
Thank you, Milan. That links to the question of eligibility. So what you mentioned at the end, how are the decisions made and how are the organizations judged or evaluated during the process? Any comments from the panel there? Someone mentioned, I think Faustine mentioned the point of coherence and eligibility criteria, and they can be seen from different angles. The organizations like the Liver Patient Association, who do not receive, I believe, the operating grants from the Commission, need to find a different way of funding. Foundations will not necessarily fund patient organizations. That means that we have to go to the industry as a source of funding. How do we cut that knot? I don't think we can detangle it. We need to cut it. How do we cut it? Any thoughts?
Sorry, may I ask something? Because we had lots of fight here in the parliament to have the EU4 House budget, and it's okay. It's not the biggest part of the European budget, but it's 12 times bigger than before. I had lots of fights because of it here in the House. And I realized that I met with the HDA several times, and they promised me they will open grants, supports, tenders for the NGOs. Is it correct? So have they started it or not? Because as a decision maker, I have this information. And of course, I'm not there every day to check who got and who doesn't have any kinds of support. Is it not true?
Maybe I can take on
Yeah,
that one,
please.
yes. So in principle, the operating grants, as we said at the beginning, were reinstated, but it is only 18 NGOs that receive operating grants from DG Sante in 2023. Freek was mentioning 30 by DG Employment. It's not a massive number, and of course the Commission has their own criteria based on the excellence of the proposal, based on there are all sorts of eligibility criteria. The one I mentioned about the previous funding. How does an organization ever get out of, for instance, industry funding if those eligibility criteria are not changed is a different point. But to your point, yes, the operating grants are back. There are 18 organizations at the EU level that have received funding from DG Sante, from the EU4 Health program this year.
I like to just to say something. What is very important, because you mentioned that more or less we are funded from the industry. We try and struggling, especially the past 3 years, 60% of our budget, even we are not anymore from the industry. We're trying from different kind of approaches, philanthropy and let's say combining with the research projects which are coming from the European Commission, but also that need huge work also. Collecting consortiums, I don't know, partners and everything, but it's big challenges. And also ELPA, it's like a patient can be a leader partner in that projects, but it's good that we are there and we are getting some research. In the moment we have about 16, 70 projects we are running in the same time, which is giving let's say accessibility, affordability, and in the same time that we are some kind of eligible for the European Commission, but still we have the challenge to get a real grant, operational grant from the Commission.
Thank you, Milan. And that goes back to Freek's comment